the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said...
It doesn't sound like you are. If that's...
Are you going to let me answer? Or are you going to keep interrupting?
Are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're
and
answering
the reason
that's really dangerous for the American public and for families.
The reason people have lost faith in this program is because
what started as a routine oversight hearing quickly turned into one of the most heated exchanges Washington has seen in months, as Senator Chris Murphy directly confronted Health and Human Services Secretary Robert F. Kennedy Jr. over vaccines, public trust, and whether Kennedy misled Congress during his confirmation. Before we go any further, take a moment to subscribe to the channel. These exchanges shape real-world health policy, and subscribing helps you stay informed beyond the viral clips.
Thank you very much, Madam Chair. Secretary Kennedy, I want to talk to you about your relationship with this committee and this Congress. I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusations. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine, but you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in front of—
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. You're Senator begging your progress. You do not know what you're talking about.
For the record.
Let's have a little bit of order so that you can get
Madam
your
Chair,
question
I'm speaking. I didn't ask for a response yet.
I understand.
I'd like to lay out the predicate of my question before I'm interrupted by the witness. He should have some respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you've said about the vaccine. And the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but the lake is probably toxic and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's going to swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine. And so I guess I have two simple questions for you. One is, can you clarify what you said in the House this morning? Are you or are you not recommending that families get their children vaccinated, or are you just giving people the pros and cons? And do you understand that when you say these things about the measles vaccine, what ends up happening is less people get the vaccine? That may be what you want, but do you understand that the result of constantly questioning the efficacy or safety of the vaccine results in less people getting the vaccine? So I don't necessarily want to spend the remaining 20 seconds in an argument over the science, but do you at least understand that that's the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said, and
Doesn't sound like you are. If that's,
are you going to let me answer? Are you going to keep interrupting?
Are you or are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're
And the
answering the
reason
question. That's
that
really
people-
dangerous for the American public and for families.
The reason people have lost faith in this program is because they've been lied to by public officials for year after year after year.
No longer recommending the measles vaccine.
Senator Marshall.
Murphy did not mince words. He accused Kennedy of saying one thing under oath and doing another once in office, arguing that this breakdown of trust is not just a political problem, but a public health risk. At the heart of the clash was Kennedy's confirmation pledge that he would not reduce or divert congressionally appropriated funding for vaccination programs. Murphy pointed to the cancellation of roughly $12 billion in public health grants to states, funding that states use to administer vaccines, track immunization rates, and educate the public. Whether Kennedy personally ordered those cuts or not, Murphy argued that the result directly contradicts the assurances Kennedy gave lawmakers who voted to confirm him. If you want coverage that explains why funding decisions matter long after the hearing room clears, make sure you subscribe. The exchange grew more tense as Murphy broadened his case. He reminded Kennedy that during confirmation, he promised not to change vaccine approval standards from historical norms. Yet, Murphy said, Kennedy later announced new standards that his own department described as a radical departure from current practice, a move experts warned could slow vaccine approvals. Then came the most emotionally charged part of the confrontation, the measles vaccine. Murphy acknowledged that Kennedy often says he supports the measles vaccine, but he argued that support in name means little if it is paired with repeated public statements that cast doubt on safety, testing, and effectiveness. Murphy cited Kennedy's public comments claiming the vaccine was insufficiently tested, that immunity wanes quickly, and that it contains fetal debris, claims widely disputed by medical experts. Murphy's central point was not about one scientific dispute, but about messaging. He argued that when a cabinet-level health official publicly raises doubts about vaccines, even while claiming neutrality or transparency, the real-world consequence is predictable. Fewer people get vaccinated. Subscribe now if you want reporting that connects political rhetoric to real consequences for families and communities. To make the point clear, Murphy used a vivid analogy. Telling people to get vaccinated, he said, while simultaneously warning them of dangers, is like telling someone to swim in a lake while emphasizing the presence of alligators. Technically, you may still be recommending the swim, but practically, no one is getting in the water. Murphy pressed Kennedy on two simple questions. Was he actually recommending that families vaccinate their children against measles, or was he merely presenting pros and cons without guidance? And did he understand that repeatedly questioning vaccines leads directly to lower vaccination rates? Kennedy pushed back forcefully. He insisted that his responsibility is radical transparency, telling the public everything that is known and unknown about vaccines. He argued that respecting people's intelligence means acknowledging risks rather than repeating blanket assurances that everything is safe and effective. But that response only deepened Murphy's concern. From Murphy's perspective, the job of the nation's top health official is not just to share information, but to lead clearly, especially when misinformation is already widespread. Murphy warned that ambiguous messaging from the top erodes trust, increases vaccine hesitancy, and ultimately costs lives. This was not an abstract debate. Measles outbreaks have been rising in parts of the country, driven largely by declining vaccination rates. For Murphy and many public health experts, the fear is that mixed messages from the federal government could accelerate that trend. As the chair tried to restore order and time expired, one thing was clear. This was not just a clash of personalities. It was a fundamental disagreement about the role of government, the meaning of truth, and how much responsibility public officials bear for the consequences of their words. Subscribe to the channel for continued coverage that goes beyond the shouting and explains what these moments mean for policy, public trust, and everyday life.